bacteria which caused by the bacteria named Streptococcus pneumoniae, which causes the inflammation by illness, which comprises of three parts that are alveoli, respiratory bronchial, alveolar tract. Route of transmission: via inhalation, pneumonia will transfer. Aspiration, the fluid will be shifted. Hemorrhage spread and a direct spread. Direct spread refers that it affects in a particular area with different types of organs. Hemorrhageous spread, it affects the organ through a blood. Next, classification of pneumonia is of three groups based on their anatomical region, based on etiological agent, and based on their community spread. Based on anatomical region, the pneumonia will affect on the lung by three parts. Lobular, and interstitial space. Lobar, which affects the infection in the lobes of the liver. In the right lung there are three lobes, in the left lung there are two lobes. Next, the lobular, which affects the bacteria in the bronchopulmonary segments. Next, interstitial space, a space between the capillaries and the lung alveoli. Next, based on etiological agent, they are classified as three groups: bacteria, fungal, and virus. Bacteria named by the Streptococcus pneumoniae, virus, Haemophilus virus, and influenza virus are fungal Mycoplasma species. Based on environment, as the pneumonia was transferred: CAP, community associated pneumonia; VAP, ventilated associated pneumonia; and healthcare associated pneumonia are nosocomial. Pathogenesis of a pneumonia: by inhalation, the bacteria will affect the upper and lower respiratory tract. So, in case of weaker immunity, the bacteria will enter into the bloodstream. In case of stronger immunity, the bacteria will kill in the particular region. In this case, we can see about the weaker immunity patients. For weaker immunity, the bacteria will enter into the alveoli. In alveoli, the neutrophils and macrophages are present. Macrophages try to kill the bacteria which invades into the cell or a lung, and it enters into the alveoli. That is, the fluid shift from the capillaries to the alveoli. Thus occurs the formation of pus, and thus there is an inflammation caused, and the fluid occurs so that the lung will inflame. So there is no external gases, thus it causes a shortness of breath. Symptoms: a patient has shortness of breath, tiredness, coughing, fever, etc. Pneumonia. There are 4 stages of pneumonia which affects our patients. The first step is congestion, second step is red hepatization, third step is grey hepatization, fourth step is resolution. In the first step, congestion, within 1 to 3 days the lung will inflame and that becomes a liver-like texture. Red hepatization, within 3 to 8 days the lung will appear in red in color, and in the grey hepatization within 8 to 10 days the lung will appear in the grey color. Resolution, the lung will become normal with the antibiotics. Diagnosis of pneumonia: there are such cultures which we calculate the or determine the bacteria which infects. There are blood and sputum culture, FNAC, fine aspiration, and bronchoscopy. Treatment: antibiotics which treats the pneumonia.